What is premature ejaculation? Premature ejaculation is a common sexual condition in men. It affects many men at some point in their lives and can have a negative impact on their quality of life and relationships. This occurs when a man ejaculates faster than he or his partner would like during sexual activity. This happens before or shortly after penetration and can cause stress and tension in the relationship. This can lead to feelings of frustration, embarrassment, or anxiety in both partners. The lack of control over the timing of ejaculation can make men feel insecure and less satisfied with their sex life. Stay with this video until the end to learn the possible causes and how to manage them. You'll also learn the tools that will help you begin the path to resolving this disorder, the most commonly used treatments, and the most relevant practical advice that will help you achieve your goals. Premature ejaculation is defined as ejaculation within the first minute of penetration. However, some experts also consider premature ejaculation if it occurs before the man desires it, even if it's after 1 minute. It's important to remember that every couple is different, and there's no set number for how long sexual intercourse should last. Sexual satisfaction is subjective and varies from couple to couple. The key is whether ejaculation occurs earlier than desired, causing distress. If premature ejaculation interferes with your sex life and causes emotional problems, it's important to seek help. If you're concerned about premature ejaculation, it's important to talk to your doctor. A healthcare professional can offer guidance and support and help you find an appropriate solution. He can help you determine if you have premature ejaculation and discuss possible treatment options. There are several strategies and therapies available that can improve ejaculatory control and reduce associated anxiety. Know that you are not alone, and help is available. Talking openly about your concerns and seeking support can make a big difference to your emotional well-being and the quality of your sexual relationships. Psychological causes of premature ejaculation. While the exact causes of premature ejaculation are complex, there is often a combination of psychological and biological factors. Psychological factors can play an important role in premature ejaculation. Anxiety. Performance anxiety, especially in new relationships, is a common factor. Emotional pressure to perform can lead to rapid ejaculation. Stress. Daily stress from work, relationships, or finances can affect sexual performance. Depression. Men with depression may experience changes in libido and sexual function, including premature ejaculation. Relationship problems. Unresolved conflicts or poor communication with your partner can create tension and contribute to premature ejaculation. It is important to address these underlying psychological factors to manage premature ejaculation effectively. Biological causes of premature ejaculation. In addition to psychological factors, several biological factors can contribute to premature ejaculation. Hormonal imbalances. An imbalance in certain hormones, such as serotonin or testosterone, can affect ejaculatory control. Serotonin, a neurotransmitter, appears to play a key role in regulating ejaculation. Increasing serotonin levels improves ejaculatory control in men. The influence of testosterone on premature ejaculation may involve several mechanisms. For example, elevated testosterone levels could increase sexual arousal and sensitivity, leading to a lowered ejaculatory threshold. Neurological factors. Problems with the nerves that control ejaculation can also play a role. Prostatitis. Inflammation of the prostate gland, the sensitivity and pain it produces, can provoke a more rapid response, triggering premature ejaculation. Conversely, pain or the psychological effects of a chronic illness can provoke a delayed response. Thyroid disorders. Both hyperthyroidism, overactive thyroid, and hypothyroidism, underactive thyroid, have been linked to sexual dysfunction, including premature ejaculation. If you suspect a biological factor could be contributing to your premature ejaculation, consult your doctor for a proper diagnosis and individualized treatment. The relationship between premature ejaculation and other conditions is a relevant topic that we must keep in mind. Premature ejaculation can sometimes be a symptom of other underlying health conditions, which means it could be an early warning sign. It's essential to be aware of these potential links. For example, erectile dysfunction is a condition frequently associated with premature ejaculation. Men with erectile dysfunction may experience premature ejaculation due to anxiety about maintaining an erection, which creates a state of worry and performance. Nerve damage caused by diabetes can affect ejaculatory control, increasing the risk of premature ejaculation. Additionally, diabetes can affect blood circulation, which can also affect sexual function. Some studies suggest a link between premature ejaculation and an increased risk of heart disease, possibly due to shared risk factors such as stress and anxiety. Cardiovascular health is essential for sexual function. Substance abuse, such as alcohol and drugs, can also play a significant role. Alcohol and drug use can interfere with sexual function and contribute to premature ejaculation, as these substances can affect the nervous system and circulation. If you have any of these conditions and experience premature ejaculation, it is crucial that you speak to your doctor to obtain a proper diagnosis and an individualized treatment plan. Addressing the underlying condition can not only improve your sexual health, but also your overall well-being. Early intervention and proper treatment can make a big difference. Making simple lifestyle changes can often improve the symptoms of premature ejaculation. Reduce stress by practicing relaxation techniques, such as deep breathing, yoga, or meditation, to control your stress levels. It's also important to limit alcohol and caffeine, as excessive consumption can aggravate anxiety and contribute to premature ejaculation. Regular physical activity can significantly help reduce stress, improve your mood, and potentially increase your libido. So talk openly with your partner about your concerns and what feels right for both of you. These lifestyle adjustments can contribute to an overall healthier lifestyle, potentially improving your sexual health. There are two main types of therapy: behavioral and psychological. The latter consists of psychosexual counseling for men and their partners, addressing psychological and interpersonal problems. Behavioral therapy includes physical techniques to help patients develop skills to delay ejaculation and improve self-confidence. The goals of psychological treatment include learning techniques to control, delay, or both ejaculation, gaining confidence in sexual performance, decreasing performance anxiety, overcoming barriers to intimacy, resolving interpersonal problems that precipitate and maintain dysfunction, identifying feelings and thoughts that interfere with sexual function, and increasing communication. The following techniques are part of behavioral therapy. The stop-start technique involves the man or his partner stimulating the penis until he feels the urge to ejaculate, then stopping until the sensation passes. This is repeated several times before allowing ejaculation to occur. The goal is to understand the sensation of arousal in order to improve control over it. In the squeeze technique, the patient's partner stimulates the penis until the urge to ejaculate occurs, then presses the glands until the sensation passes. This is repeated several times before ejaculation is allowed to occur. These therapies provide you with tools to cope and strategies to manage the psychological aspects of premature ejaculation. There are several medical treatments available for premature ejaculation, often used in conjunction with lifestyle changes or therapy. These treatments can be very effective and range from topical options to oral medications and specific exercises. Topical anesthetics, such as numbing creams or sprays containing lidocaine or prilocaine, can be applied to the penis to reduce sensitivity and delay ejaculation. These products are easy to use and can provide quick relief, although it is important to follow your doctor's instructions to avoid unwanted side effects. Condoms must be used after application to prevent direct exposure of the medication to the vaginal mucosa and external genitalia of the partner. Oral medications, such as selective serotonin reuptake inhibitors, SSRIs, originally used to treat depression, have been found to delay ejaculation as a side effect. These medications can be an effective option, but it's crucial to discuss potential side effects and how they may interact with other medications you're taking with your doctor. Daily SSRIs are the first choice of treatment for patients with premature ejaculation. These include paroxetine, sertraline, and fluoxetine. Dapaxetine. This is a potent SSRI, specifically designed for the treatment of premature ejaculation. Its pharmacological profile supports the role of on-demand treatment. Dapaxetine prevents the transport, rather than the reuptake, of serotonin. Compared to traditional SSRIs, it reaches its peak concentration within 1 hour and is then rapidly eliminated from the body. Tramadol. Tramadol is a potent centrally acting opioid analgesic prescribed for pain management. Its effectiveness in treating premature ejaculation is due to the neuromodulation of serotonin and norepinephrine receptors. Phosphodiesterase type 5 inhibitors, sildenafil, tadalafil, and avanafil, are drugs indicated for the treatment of erectile dysfunction. Their prescription in patients with premature ejaculation is still debated. Intravaginal ejaculation latency is not significantly increased, but they do increase confidence, perception of ejaculatory control, and sexual satisfaction, in addition to decreasing anxiety and reducing the time to achieve a second erection. Therefore, phosphodiesterase type 5 inhibitors should not be prescribed in patients with premature ejaculation and normal erectile function. Alpha-1 adrenoceptor antagonists. These medications are the gold standard for reducing lower urinary tract symptoms in patients with prostate disease. The most commonly prescribed alpha-1 blockers for the treatment of premature ejaculation include tamsulosin, silodosin, terazosin, and alfuzosin, which have demonstrated a statistically significant increase in intravaginal ejaculation latency time. Tricyclic antidepressants. Like SSRIs, tricyclic antidepressants such as clomipramine exert their effects by inhibiting serotonin and norepinephrine transport, increasing the concentration of serotonin and norepinephrine in the synaptic cleft, and delaying ejaculation through activity at 5-HT receptors. The main disadvantage of tricyclic antidepressants is their side effects: fatigue, nausea, dry mouth, hypotension, flushing, and dizziness. Surgical treatment. Surgical treatment has gained popularity in Asian countries. However, it has not yet gained acceptance in the rest of the world. Currently, 3 surgical approaches have been described: dorsal nerve neurectomy, glans penis augmentation with hyaluronic acid, and circumcision. Strengthening the pelvic floor muscles. Through pelvic floor exercises, often known as Kegel exercises, you can improve bladder control and potentially delay ejaculation. These exercises are easy to perform and can be done anywhere, making them a convenient option for many men. It's essential to consult with your doctor to determine the most appropriate medical treatment option for you, considering potential side effects and your overall health. A personalized approach can help you find the most effective and safe solution for your specific situation, thereby improving your quality of life and overall well-being. Do you like our content? We'd be very happy if you gave us a like, subscribe, hit the bell, and share this video so more people can see it. Remember that premature ejaculation is a common and treatable condition. By addressing the underlying causes and exploring the various treatment options available, you can regain your intimacy and enjoy a fulfilling sex life. Don't hesitate to contact your doctor or a qualified mental health professional for guidance and support.